Morning. Hey everyone, it's the Nurse Professor. I've received several messages from students asking me for advice about how to go about becoming a nurse. So, with that being said, I wanted to put this quick video together to talk to you about your journey of becoming a nurse. What does that look like? What do you have to consider? What are some risk factors? What should you look for in a program? Where should you begin? Well, the first thing I want to say to you is you have to make sure that this is your season. And what I mean by season is this the right time, based on everything that's going on in your life, for you to consider going into a nursing program? For some people that have experienced a death in the family, a life-changing event, maybe you've moved, maybe you've gone through a divorce, maybe there's financial issues, or you don't have any support from families and friends, this might not be the right time for you because you want to be able to set yourself up for success and you need that support, okay? So just consider that. I've seen students be enrolled into a nursing program and not be successful because of some of those risk factors. But if you eliminate the risk factors, you really have a good foundation to begin your career in nursing. The second thing I want you to consider is, what impact is this going to have on your marriage, on you being a mom, on you being a dad, on you being a child of someone? What is that going to look like? There's a lot of time that's involved in nursing, okay? When you get into a nursing program, it's very time consuming. It's a huge commitment, and you need to be able to say, for the next 2 years, I can't go on vacation to the beach. I can't go to Gatlinburg. I can't go to Hawaii. You have to consider that you have to put nursing school first. It has to be that priority. And if you don't make it that priority, or you can't make it that priority, then chances are you're going to struggle in the nursing program. So one of the things I always would tell students when I was the dean of nursing, I'd have this huge family and friends night. And I literally would tell the families and friends, for the next 2 years, don't ask them to go out to dinner. Don't ask them to take a girls' trip. Husbands, you need to step up to the plate and you need to be cooking dinner. You need to be changing those diapers. If you want your person that you love to be successful, then you have to step up to the plate and go through this journey with them. So I wanted to share that with you too. Also, some students think that it's just really easy to get into a nursing program and just have to apply and I'm in. Most nursing programs have selective admission requirements, and what that means is you get points for everything you've done prior to coming into a nursing program. For example, your GPA. Have you taken care of your prerequisites? Have you got them out of the way? What is your grade that you received in these prerequisites? So you get points for all of those things, okay? So you have to consider that. Some nursing schools enroll twice a year, some enroll once a year, some enroll every month. So you have to make sure you find the right fit for you based on everything that's going on in your life. Okay, so then let's talk about what the nursing journey looks like. So you have to begin with that end in mind. Do I want to be an RN working at the bedside? Do I want to be in leadership? Do I want to get my bachelor's degree? Do I want to go on and educate myself to be an NP, which needs a master's degree? Or is your ultimate goal that you want to be a doctorate of nursing practice? So there's several levels to that. So it's kind of like peeling a banana back or peeling an orange or something with layers, an onion, peeling an onion back. Many times it starts with students being a nurse aide or a medical assistant. Those students that have like one up and have been exposed to the healthcare environment typically do much better in a nursing program because they have some experience. Most colleges will require you to do an entrance exam, whether it's the TEAS or the HESI AT or the TOEFL exam. So look and see if the colleges that you consider going into require you to take an entrance exam so you can get into the nursing program. And 9 times out of 10, you have to score a certain score. I've seen it as low as 50 and as high as 85. So check with them. Once you've taken that entrance exam, you now have applied to the nursing program and you've been accepted, okay? So nursing program takes a lot of your time. You can anticipate spending about 40 hours a week being able to be successful in that nursing program. Between homework, exams, clinicals, going to the lab, all those good things, having groups, expect 40 hours a week. So now you're in the nursing program and you've graduated. But before you can practice, you have to take the NCLEX. And whether you're going to be a PN, which is an LPN, or an RN, before you can practice as a nurse, you have to take that certification exam. And there's a certain threshold that you have to meet, or certain percentages in these 8 different categories that you have to be at or above, okay? It can be very challenging studying for the NCLEX, but you can do it. Now you've passed the NCLEX and now you're going to go out and get a job. I tell students this all the time. Don't enroll into a BSN program. Go get your associate degree and then get working. Do 312s and then let your employer pay for you to go back to school to get that bachelor's degree. A bachelor's degree is typically 18 months and you can do all of it online. And there's no clinicals with that. Lastly, one of the things that I want to share with you is that many students can work and they can work 1 or 2 jobs, save up that money, and then be able to afford to go back to school if their employers are not going to pay for it, but most employers will. Now you've got your bachelor's degree and now you've decided that you want to be a nurse anesthetist, or maybe that you want to be a women's health nurse practitioner or a family nurse practitioner. That requires another 2 years of nursing school, and there's lots of clinical hours there. So at the end of the day, I want you to consider, what is my end goal? Along this journey, being a nurse aide, a nurse, getting my bachelor's degree, getting my master's degree, and even going on to get my doctor's of nursing practice, what is the end goal? And I tell students all the time to begin with the end in mind. So I hope this has been helpful for you. As always, reach out to me for any questions that you have, or leave me a comment in the comment section, and I'm more than happy to help you. Everyone, have a great day, and always remember that there's nothing that you can't accomplish, okay? You're special and you have a purpose in this life, and if you want to become a nurse, it can happen. Take care, everyone.